I'm very happy to introduce Trish Hennessy, who is the director of Upstream, a project of the Canadian Centre for Policy Alternatives that is dedicated to policy solutions that foster a healthy society and community well-being. Trish is also a senior communications strategist at the CCPA. She's focused on the eco-social determinants of health, sustainable development goals, income inequality, decent work, and an inclusive economy. Trish was the founding director of the CCPA in Ontario, which is a progressive think tank that focuses on provincial and municipal social justice and economic issues. She co-founded the Ontario Living Wage Network. She was the founding director of the CCPA National Office's Growing Gap Project, which began in 2006. Trish was a former newspaper journalist, originally from Saskatchewan, but she now lives in Toronto. She has a BA in sociology from Queen's University, a BSW from Carleton University, and an MA in sociology from Ontario Institute for Studies in Education at the University of Toronto. We're very much looking forward to Trish talking to us about going from me to we to promote upstream investment. Trish, it's all yours.
Thank you, Malcolm. It's such a pleasure to be here. Craig? It's such a pleasure to be here. And I just want to clarify, the title of that talk was written before the we scandal. Just to put that on the record.
Yes.
Look, I'd really like to thank the Atlantic Summer Institute for your leadership on expanding the conversation about mental health to focus on the value of upstream solutions. You're doing amazing work. Those consultations and recommendations were super impressive. And I want to just give congratulations to the organizers for putting together such an interesting agenda over the next few days and, under trying circumstances. Although we were all supposed to be meeting in person in beautiful Charlottetown today, clearly COVID-19 had other plans for us. So here I am, I'm speaking to you from my condo in Toronto, which is located on the traditional territories of the Anishinaabe, Wendat, Haudenosaunee, Mississauga of the New Credit First Nation, and Huron Indigenous peoples. And together with other First Nations, these peoples created a treaty in 1616 that covered a massive stretch of land from Wisconsin through the Great Lakes Basin to the St. Lawrence. And it was called the Dish with One Spoon Treaty, where the dish represents the land, the water, and the air that we all share. The dish with one spoon concept feels more relevant than ever as we navigate through a global pandemic. An experience that we're all sharing, though not equally, and one that we must navigate through together. So by now, we're long past the shock of COVID-19, the virus that shut down the world, the economy, and the relative predictability of our lives. Millions of Canadians have lost their ability to earn a living because of the pandemic. They risk eviction, mortgage default, food insecurity, homelessness, and mental health struggles. And those who still have a job either find themselves on the front lines risking exposure to the virus, or they work from home, perhaps isolated and also caring for family members at the same time. And maybe they're grieving. Canada has recorded over 9,000 deaths so far related to COVID-19. And so there's much to grieve and there's a lot to feel anxious about because we don't really know what the future holds. And yet there is so much that we do know. We do know that we have been tolerating rampant income inequality in Canada, the likes of which we haven't seen since the 1920s, with little action or even outrage to address it. We know that we know about the rise of precarious work, which is infecting all lines of work. Even people who work in professions are subject to precarious working conditions. And COVID's impact on the economy may be exacerbating precarious work. We know about the refusal of a lot of governments to make the minimum wage a living wage, or to ensure income adequacy for people who receive social assistance. For youth, there's the reality that you need an education, a higher education, to get a job today, but that also entails racking up a student debt, the size of a mortgage down payment. And then, of course, navigating the education system in the middle of a pandemic brings with it its own set of stresses and challenges. For young Canadians who do manage to land a job and start their family, they soon discover that Canada has no coordinated national early learning and childcare program for children under 4. And as a parent, it's now your job to find childcare that is often so expensive, it's the size of a monthly mortgage payment. So what does any of this have to do with mental health? Well, these are just some of the stresses that were already there for Canadians, and especially young Canadians, even before COVID-19 struck. And now they're compounded by a pandemic that has disrupted the childcare sector, disrupted classroom education, disrupted academic careers, and the working lives of many Canadians. And this disruption is resulting in dramatic consequences for our mental health and well-being, and especially for women and youth. A recent Statistics Canada survey shows that younger Canadians and women are less likely to be reporting better mental health outcomes in the middle of this pandemic. And this is especially true for households with children under the age of 18. Their ability to meet financial obligations is a major source of their stress. Canadians with a compromised immune system, people with diabetes or chronic conditions affecting lung, heart, kidney, they're also less likely to be reporting better mental health outcomes during this pandemic. And those survey results tell us something. The findings suggest that family stress due to confinement is a really important factor. It's significantly associated with worse mental health outcomes. But those families aren't alone in their stress. A recent York University and UBC survey indicates that the number of Canadians who report fair or poor mental health has tripled during the pandemic, rising from 8% before COVID-19 to 24%. More than half of Canadians said that their mental health has worsened as a result of physical distancing. And that survey also reveals that COVID-19 doesn't impact all communities equally. In fact, East Asian Canadians report a disproportionate mental health impact from the pandemic as a result of targeted racist attacks, violence, and discrimination. The survey is a reminder that mental health isn't just about what's in your head. It's about the circumstances in which you were born, where you live, and what's happening in your community. Since the start of COVID-19, there has been a rise in anti-Asian hate crimes across Canada. And when we think about the social determinants of physical and mental health, race, ethnicity, and gender are critical factors due to racism, xenophobia, misogyny, and other forms of discrimination. And this holds true for Indigenous peoples too. In a recent Statistics Canada crowdsourcing study, 60% of Indigenous participants indicated that their mental health had worsened as a result of physical distancing in the COVID era, that their days were full of stress. And that study found that Indigenous participants were more likely than non-Indigenous participants to report fair or poor mental health. Now, of course, we can all understand feeling stress and anxiety and depression and loneliness in the middle of a global pandemic that promises no end in sight is a fundamentally human response to the circumstances. We're not just brains walking around in a human suit. We're living organisms who respond to our environment, whether it's our built environment or our natural environment. Now, the built environment, the communities that we live in, the economic system that we work in, that impacts our mental health and life chances in so many ways. But income inequality is the river that runs through it. It's a major social determinant of mental health. And so let's talk about that. Income inequality is at the root of many of our social, physical, and mental health problems. In their important book, The Spirit Level, Richard Wilkinson and Kate Pickett demonstrated how societies that tolerate high levels of income inequality suffer. Everyone suffers when there's lots of income inequality, even the rich. They suffer from worse health and mental health outcomes, from higher crime rates, less trust in public institutions, and less trust in each other. In their newest book, The Inner Level, Wilkinson and Pickett drill down further on how income inequality impacts people's physical and mental health. And at the heart of their analysis is a simple observation. The pursuit of economic growth fails to protect people from the mounting burdens of stress, anxiety, and mental illness. They write about the deep psychology of inequality, where people become obsessed with social status and the pursuit of their own success, how they become rooted in an individualized view of the world, measuring their success against where they are along the social gradient, rather than looking at success through a collective well-being lens. Wilkinson and Pickett write that inequality makes problems with social gradients worse. It affects who we mix with as our lives become defined and restricted by class and status. It affects social cohesion, the sense that we're all in it together. It increases anxieties about status and the pursuit of more. And it heightens consumerism and conspicuous consumption. Wilkinson and Pickett find that this toxic combination of factors derived from inequality and the pursuit of more impacts our mental health in profound ways. Mental health and infant mortality rates are 2 to 3 times higher in more unequal countries. The stress of social status differences are felt even more acutely by those who are in the lower rungs of the income ladder. Factors that influence social status, such as anxieties about exams and jobs and money and debt, household debt, they not only impact mental health, they also affect people's physical health because it reduces their life expectancy. The anxiety reduces the number of friendships in your lives. It reduces the amount of engagement that you might have in your community. It can lead to social isolation. And so the conclusion is income inequality affects mental health, and mental health impacts physical health. They're intertwined. And that's something that I hope we really think about during a pandemic that impacts people differently depending on our income level, the type of work that we do, whether we're raising children on our own or as a couple, whether we live alone or not, whether we have the means to stay physically isolated and to order in food and grocery delivery in order to limit public contact, whether we have the ability to keep paying the rent or the mortgage if our jobs are impacted by COVID-19. Many people are going to fall further behind because of COVID-19. It was already a struggle to get by in an economic system that awards the minority of people with the biggest share of the income pie, while the rest of us were pretty much left to scramble over the crumbs. And that's really been the story in Canada for about the last 4 decades. Between 1982 and 2017, the real market incomes of the richest 1% grew by, on average, $286,000. So let's compare that the same time period. What happened to the average market incomes for the bottom half of Canadians? Their market income decreased by $1,400 over that period. They lost ground. And that explains a lot of the middle class anxiety that you hear about in the news. And we know it's even worse for Canadians who are in the bottom of the income ladder, who are trapped in poverty. COVID-19 threatens to exacerbate these inequalities. My colleague David McDonald looked at who's gained working hours in Canada since the economy came to a halt in March, and now we've been slowly reopening it. And long story short, the lower down the income ladder you are, the greater the work disruption you are likely to have experienced. And that's in part because the pandemic has hit lower paying jobs the hardest, such as retail, accommodation, tourism, the service sector. These are sectors that are not typically that hard hit during recessions, but they've been devastated in the pandemic and the economic slowdown. And those jobs probably aren't returning quickly. Before COVID-19 struck, Canada was already tolerating high levels of income inequality. Disparities between workers are heightened by factors like race, ethnicity, and gender. For every dollar that a white man in Canada earns on average, racialized women earn just 59 cents. Racialized men earn just 78 cents. Racialized immigrant men earn just 71 cents. Meanwhile, the prevalence of poverty among First Nations children is 3.8 times higher than non-racialized, non-Indigenous children. These are dramatic income disparities. They contribute to physical and mental inequities, mental health inequities. The presence of COVID-19 and the necessary public health steps that we need to take to protect each other shines a light on the existing inequities that were already baked into the system. And now enter the year 2020, it's basically a dumpster fire. So what do we do next? Well, what if we look at mental health from a collectivist structural point of view? It entails moving beyond the current discourse about mental health. That discourse focuses mostly on destigmatization. And I think we need to go a step further. We need to go deeper than that. Here's what I mean by that. Every year, for instance, celebrities and politicians go public with their mental health issues, the depression, anxiety, as part of the National Bell Let's Talk Day. It's an excellent initiative, and the goal is to destigmatize mental illness, which is an important step to make it safe to talk about mental health and to seek supports. It's a crucial part of moving forward. Yet every year, I can't help but think that the conversation remains stuck at the me level. Like, what can I do to work through mental health issues if I can screw up the courage to talk about it and find help? If I can afford to pay for private counseling, because there's not a lot of public services available. And if counseling is even available in my community. The focus on my mental health overlooks the systemic issues that can determine whether you or I struggle with mental health challenges in the first place or can readily address them. Systemic issues such as inequality. So let's take that destigmatization conversation a step further, because stigma is a structural phenomenon. Let's tackle the structural factors that impact mental health and well-being. Let's move beyond the medicalization of mental health and treat the root causes. Damius Puris, the United Nations Special Health Rapporteur, he argues that mental health can't be treated like physical health problems. He's also highly critical of the pharmaceutical drug companies, saying government action is the antidote, not drugs. Government action is the antidote. I see COVID-19 as the impetus to move toward an upstream approach to mental health. Not only because more Canadians are going to emerge from this pandemic with mental health issues, and a lot of people will be seeking help and looking for services, but something else happened. Something shifted this spring when government shut down our economy and created new supports out of thin air to help most people shelter down at the start of the pandemic. And what we saw collectively was the important role of government in putting public health ahead of the endless drive toward economic growth. Those of us who weren't working flat out on the front lines of healthcare, long-term care, food, retail, and delivery had time to step back and reflect. Some people may never go back to the daily grind of the commute and working in an office. Some people might question the constant pursuit of success and social status. They might make different life choices. And some people might find that they have no choices at all. Some parents may not be able to go back into the labor market because of a lack of jobs or a lack of affordable childcare. They might stay home with their young children instead. That could set women's rights back by a generation, where they remain sidelined from the labor market and where their children might not get access to the early learning and socialization opportunities that we know kids need to get hardwired to perform well in life, and services that we know kids from higher income families can readily access. Income is a major determinant of physical and mental health, but income interacts and overlaps with other social determinants of physical and mental health to reinforce long-standing health inequities. And we see glimpses of that in COVID-19. With COVID-19. So in Toronto, where I live, studies show that COVID-19 has hit Black communities harder, and those communities tend to be lower income. Now compound those stresses with evidence that Black communities in Toronto are over-policed, that Black, racialized, and Indigenous people are more likely to face police brutality and also are more likely to end up in prison. And you can start connecting some of the dots. In an upcoming study by the Canadian Centre for Policy Alternatives intern Heather Lawson, it shows that Black and Indigenous women make up only 4% of the population in Canada, but they make up almost half of all women prisoners. And Lawson submits that the amount of money that we're spending on women's prisons and incarceration would be far better spent on addressing the root causes of incarceration: racism, colonialism, poverty, trauma, and mental illness. Now, some people might say access to mental health services is the #1 thing that we can do to address all of these issues. And access is indeed a huge barrier for far too many Canadians who want to seek help, but it just doesn't exist in the community, or the wait list is too long, or the cost is out of reach. Access is important, but it's a downstream measure. It's still about repairs, not about addressing those structural issues. So let's go back to the UN's Danius Puris, who recommends that governments institute better early childhood and school programs, produce rapid intervention programs for disadvantaged children, implement policies to reduce inequality and exclusion, strengthen unionization of the workforce, and improve financial assistance for those who are in need. And this, he says, would be the best vaccine against mental illness. He's addressing those structural issues. So at the Canadian Centre for Policy Alternatives, we're working on the same. We've just released a Just Recovery Plan, a COVID Just Recovery Plan, so that all Canadians can emerge from this pandemic on a more equal playing field. Our Just Recovery Plan includes basic income standards for people who are not in the paid labor market, a minimum wage, that's a living wage, affordable and adequate housing, food security, a national universal public child care program that's available anywhere you live in Canada, pathways into higher education, skills, and training jobs, expanded access to the Canada Child Benefit and to employment post-CERB will be really crucial. Employment and pay equity, labor protections for all workers, but especially for migrant and temporary foreign workers who are especially vulnerable to exploitation, and a strategy to address anti-Asian, anti-Black, and anti-Indigenous racism and discrimination. These solutions and many more, this isn't all that's in the Just Recovery Plan. It's over 200 pages. It's a comprehensive plan. But if they were implemented by governments, it would result in a healthier and more equal Canada. And you can read more about the Just Recovery Plan if you go to policyalternatives.ca. That Just Recovery Plan will require sustained federal, provincial, and municipal government leadership and even more funding commitments than we've already seen in the COVID-19 crisis. But we also need to take a hard look at how our economy is structured to leave far too many people behind. Jacinda Ardern, New Zealand's Prime Minister, has said economic growth accompanied by worsening social outcomes is not success, it is failure. We're in the middle of a historic moment in Canada where a pandemic is showing us how important public health and well-being is to the functioning of our economy and to our communities. And of course, the most assured path to just recovery is sustainable, decent work for all. But we know this too. The old model of economic growth has failed us. The global just-in-time economy rewarded some businesses and workers while forcing a growing number of workers into precarious, low-paying jobs. And I'm most interested these days in jurisdictions that are seriously implementing inclusive economic tools to create more stable jobs for everyone. So for example, in Cleveland, the Democracy Collaborative is creating social enterprise opportunities for marginalized and racialized workers who otherwise would have no foothold into the labor market. They've created a worker-owned laundry cooperative that does laundry for the local hospitals. And that's creating good local jobs for marginalized and racialized workers, many of them who had been incarcerated and had trouble finding work. And now they have jobs and they've got hope and agency. And all of this is happening while keeping those public anchor investments in the local community. And I think that we could create similar opportunities here in Canada, leveraging government procurement and infrastructure spending to create a more inclusive economy. For instance, turning a government infrastructure investment like building a bridge or new affordable housing, which is happening, turning those investments into community benefit agreements where we employ marginalized workers and we train them to work their way into the skilled trades. And the skilled trades are part of the future of Canada's middle class. That benefits those workers and it benefits everyone. In Toronto, the Eglinton Crosstown Light Rail Transit project became the first large-scale infrastructure community benefit agreement project in Ontario. And its goal was pretty simple. It's like, we want to give historically disadvantaged communities and equity-seeking groups apprenticeship and journey person opportunities. And that's an example of what's possible when we aim to disrupt structural barriers in the economy. And when we recognize the power of local public anchor institutions, and by that I mean your city council, hospitals, universities, to leverage their public spending for community well-being. And now there's no time like the present, because COVID-19 has disrupted supply chains, it's strained the old economic model. We're in a period of major transition right now, and we must be open to new and inclusive ways of organizing our economy. And as we think about our economy and rethink our economy, we can draw inspiration from New Zealand, where the government there has been committed to well-being budgeting. Yes, economic growth is still included as a measure of success there, but it's not the only measure. All new government spending in New Zealand must advance one of these priorities: improving mental health, reducing child poverty, addressing the inequalities faced by Indigenous peoples, thriving in a digital age, and transitioning to a low-emission, sustainable economy. Now that is upstream thinking. Canada would benefit from well-being budgeting approaches within an inclusive economy model in so many ways. Money spent on downstream health and mental health interventions could be redirected to invest in the root causes. And there's no time like the present. We're living in a challenging moment in history, much like previous generations faced during the Great Depression and the Second World War. So I'm going to just end with a little story about my mom. Here's my mom and I when I was 3. And the story about my mother is that she was born into poverty in rural Saskatchewan in 1935, in the middle of a Great Depression. So her family was very poor. They had no running water, no indoor toilet, of course. They had an outhouse. The one significant thing about Christmas time is that a box of mandarin oranges would magically appear in the household. And it was a really big deal because first it meant they had fresh fruit in the middle of winter. But secondly, mandarin oranges come wrapped in this really soft green tissue paper. And so it replaced the Sears Roebuck's catalog as toilet paper in the middle of the winter in that outhouse. And it's just an example of that they were pretty poor. And despite that level of deep poverty, my mother insists that she was actually born in the luckiest time because everyone was struggling during this period. They realized that they couldn't go it alone. As farmers, neighbors knew to help each other out. The community came together in those hard times, in those years of drought. As a generation, my mother came of age at a time when there was a consensus in Canada that governments also had to play a role to lift more people out of poverty and give people a better chance in life. Labor laws over that period of time made it easier for workers to organize into unions, and the rise of unionization intertwined with the dramatic decline in income inequality. And that's how we built the middle class over the 1950s, 60s, and 70s. And it's how we improved our standard of living. And in 1965, the year I was born, Canada had a minority federal government, and that government did several things that were life-changing. It implemented a public pension plan, which dramatically reduced seniors' poverty. It made post-secondary education more accessible and affordable. So it meant that in the course of my lifetime, a kid like me could be the first in her immediate family to go and get a university degree or 3. It introduced universal public health care, which benefits us all. And that was just in 1 year. That was just round 1. So now I think it's time for round 2. I think that we have a once in a generation opportunity to get at the structural issues that exacerbate income inequality, health, and mental health inequities. And this is our generational challenge. And I think this is our moment to say, if we're going to survive a global pandemic, let's make sure that future generations benefit in the way that my generation benefited from the public policies that were implemented over the course of a lifetime, and were completely game-changing. So this is our once in a generation challenge, and the question for us all is, will we take it? Thank you, and I look forward to Q&A and more discussion.
Yes, and I'd like to thank you very much and open it up to questions. I know you've challenged a lot of our thinking, and the session Q&A is open. Just beware that people who are live streaming can ask questions on the YouTube. There's a place for questions there that you can ask, and there's someone monitoring those. And for those of you who are in the forum, you can ask your question using the session Q&A, and I will watch for the questions, and then I can pose the questions to you. That's okay?
Okay, yes, thank you.
People want to start thinking about what would they ask if they had the chance, and write it in your session Q&A. Would be great.
Or they could tell us which measures they would do first. What's the most radical thing you would want?
Okay, there you go. What would you want first? And that you can put that in the Q&A as well. So I'll write it in there. What steps would you take first?
I have a comment. I'm sorry. I'm not finding my session Q&A is really working for me, so I just want to talk. That's okay. I'll have to be quite honest with you. I started my university education in Manitoba. I'm actually not from the Atlantic provinces. And I was thinking all of these things when I started university in the year 2000, like, because I was born in 1981. So I actually went to law school with the specific goal of eradicating poverty and lifting up families. So I just don't really I'm just really overwhelmed because like I feel like this is something I've been thinking about for so many years, and I'm wondering, why are we only having this conversation now?
That's
There you go, Trish.
I share your frustration for sure. Yeah, and we've been trying to have it for quite some time. You know what? I think that sometimes people need to have a shock to the system or a series of shocks to the system. And when you think about it, we've had a number of shocks to the system. You know, it was just in 2008-9 when we had a complete global recession, economic meltdown. And there were a lot of us talking about maybe now things are bad enough that we'll ask for systems change. I think that COVID-19 changes everything. Because everyone is impacted in some shape or form. And it shows the value of governments that put public health front and center and the importance of that, not only to personal and community well-being, but you need public health in order to have a functioning economy. And that's what COVID-19 has shown us. And so I think that, and I hope that it's an opportunity and that it's a conversation that we have. And we know that our governments, and especially the federal government, is talking about major changes. And I think that what they need to hear is a lot of support to ensure that, that when they're moving forward, the public is fully behind them. There's every public opinion poll that I see show that the majority of Canadians support what's been happening here, support everything that the federal government has been doing to make sure that people don't completely fall over the cliff, and they want that sustained support. So I think that just we're experiencing something as a country that we haven't experienced, certainly in my lifetime, that the level of impact that the pandemic has had on our reality and hopefully on our thinking.
Okay, any other questions that you want to pose to Trish? Are you just all deep in thought?
Yeah, my question is, if all of the money is put into a basic income for every single human being, like I already mentioned this idea even on PEI to as a Dr. Jacqueline Goodwin. I attended her session on kids' mental health, and we talked all about the wraparound services. And I said, well, why is this not available to the parents and to the adults? And I wasn't even really given a response. So like, I'm not really understanding why we're saying we're going to put supports here, supports there. Let's support the supports everywhere. Then that's your whole point, right? Then we don't have to spend all that money when people are in crisis or already harmed or whatever. So like, where, like, direct me to the research I should be reading that shows, like, look, for every dollar that goes into preventing someone from needing to use the hospital or those public services, like, what's the best research we have right now on that, those dollars?
There's a number of studies, and I promise to share a few links tomorrow in the Whova chat for you. But there's a number of studies in terms of more upstream investments in healthcare. In Finland, they did a comprehensive 2-year experiment with basic income and found that that improved people's mental health outcomes dramatically. Lots of studies coming out of Quebec, where Quebec's early learning and childcare system is more affordable and accessible, and it actually shows that that literally pays for itself, because if you have affordable, accessible childcare, it enables parents to go out and work in the labor market, and so that income gets taxed back and it pays for itself. So there's a number of those types of studies out there.
Trish, there's a question here that's showing up in the Q&A, and the person is thanking you so much, and then she's asking, or he's asking, do you have a sense of whether or not government is or will be on board with the type of overhaul you described as being needed?
Okay, all right, so here's my crystal ball. Let's see. Look, I hope so. Certainly the last couple of days, I've seen news stories saying the federal government is, looking to do like sweeping social changes. And I know the public opinion shows that, that there'd be a whole lot of support for that. But I also know that they won't do it, unless they know that there is broad public support for that. So I think that's a huge conversation that we need to have with each other, with our friends and family and neighbors, and talk to each other about how COVID-19 changes everything, and how we have an opportunity right now, our generation, to resolve a lot of these problems that I think we got complacent about. I think we got complacent about income inequality. We certainly got complacent about child poverty, Indigenous poverty. We are one of the richest countries in the planet, and we have the resources and the ability to make these fundamental investments that's good for us now, but that will pay off in generations from now. Because that's the other thing that the research shows, that the more we invest, especially the earlier you invest on people for their life chances, then the better off they are in the future. And so we could actually undo a lot of the income inequality and poverty trends that we've been just living with complacently for the last 4 decades.
Thanks, Trish. I see Malcolm has his hand up, and there are 2 ways you can ask questions. Malcolm had put his hand up, and I noticed there are, there's a comment in the Q&A. Also want to ask, Malcolm, I'll let you go ahead, but I just want to check with the staff to see if there's anybody who is writing comments on the online live stream. So if you can just let me know that, I'll let Malcolm go ahead, and then I'll watch for your message. If you could send me a text, that'd be super.
Thanks, Patsy. Trish, somebody else is going to do the official thanking, but I just wanted to say thank you to you personally for your powerful remarks, which have covered the whole gamut of issues that are at the root of the mental health challenges we are experiencing in the COVID era. And it's just to me, it's overwhelming, and I've been at this a very long time. It's overwhelming to hear it all so beautifully woven together in a powerful argument for the things you just talked about. I was going to ask a question about what you might say to the Atlantic premiers, but I think you've already answered it in your just previous remarks. So I'm looking forward to reviewing some of those recent references that you've made, and also to trying to capture the essence of what you've been talking about as we formulate a policy agenda to take to the Atlantic premiers. So that's not a question, that's a comment. Thank you so much.
Okay,
Fabulous. Thank you, Malcolm. And I mean, the advice that I would give to all of the premiers and all of the mayors across the country is you can't just let the federal government do the heavy lifting. I mean, the federal government has to do a lot of the heavy lifting, but we actually need to be arm in arm on this one because the challenges are too steep.
Thank you, Trish. There's time for one more question, and then I'll call on Philip Brown, to our mayor, to thank you. Sylvie, I see your hand is up.
Thank you so much, Patsy. Thank you, Trish. Was a wonderful, wonderful keynote there. I'm wondering about what we are experiencing now. I love the shift and the push and the impetus that the present CERB, or as some people call it, CURB, is getting, that it assures people that there is a safety net, and we want everyone to have a safety net. At the same time, we have the experience of companies, especially small to medium-sized companies, saying, well, this is discouraging folks to come back to work. And I've seen that in especially one of the medium-sized companies that I'm more closely associated with, where 90% of the folks did not choose or chose not to come back, citing various reasons. And one had to go ahead and quickly start hiring temporary staff members who comprised largely of school-going youth as well as seniors. And the two categories that were not receiving the CURB benefits. I love to be able to have universal social security, a livable income, and I'm just wondering, how do we go ahead and balance the two? What's the way ahead?
Excellent question, and an important one that we have to work through as well. So the first thought that I have when I hear a business person saying that that these supports, CERB or CURB, is keeping people from going back to their jobs, then I ask, how does this reflect on the quality of the jobs that you are offering in the first place, and the working conditions? And where does workers' rights to have health and safety come into it? And so if then now they're going to that next tier of very desperate workers who weren't covered, who fell through the cracks, how does that reflect about your business? And is this the business model that is sustainable for your community? Is it inclusive? Is it something that it makes the community more engaged? Does it raise our standard of living? And if it doesn't, then maybe this is the question to really seriously question. This is the time to seriously question your business model. And I work with a lot of living wage employers across the country, and a number of them say that once they decided to pay a living wage, they actually had greater worker retention. Workers were happier and more engaged in the job. It changed everything. So I think my point about we need decent work. We need a adequate level of income. We need inclusive economy models and well-being budgeting by governments. And if you put these all together, then we all end up with healthier communities and more vibrant communities. And guess what every business needs to survive and thrive? Healthy, vibrant communities. And so what are those businesses doing to contribute to that? And it's part of their long-term future as well.
Trish, I've got another one for you, and I really mean that meant that it should be, time management is essential, but this is such a good question because I'm sure it's on a lot of people's minds. And I wanted to also say in the chat, there are many resources that are being listed. So it's not just the Q&A that's getting attention, it's the chat and Whova as well. What this question is do you think that divisiveness that is showing up in the media makes this more difficult to get moving? It seems to be somewhat self-perpetuating.
Exactly right, bang on. And I mean, we see what happens in the US when media and politicians foment polarization and division. it gets worse before it gets worse. And so we can look at that experiment and say, let's not do that. And so I think that it's actually really a project for each and every one of us. I worry very much about the growing polarization in Canada. And it seems to be slightly in suspension mode because of COVID-19. But we had the Wexit, in the West, rear its ugly head. There's a lot of divisive discussions on social media, people yelling at each other, judging each other, calling each other out, and that just gets people. That requires people to. It forces people to dig in their heels. It actually doesn't change the conversation. And so I think part of our job, and it's for each and every one of us, when we're talking with people who are saying something that just seems like the polar opposite of what is upstream, that it's not a question of now we're going to fight or we're not going to talk. This is when a new conversation has to happen. This is where we need to reach out and understand where's that coming from. And there I go back to Wilkinson and Pickett's research that shows societies that tolerate high levels of income inequality have less trust in public institutions and less trust in each other. And so it's all intertwined, but I do think that we have a responsibility to have those conversations from a genuinely compassionate, curious standpoint, so that we look for points of consensus and connection instead of increasingly adding to that polarization and division and hate and anger.
Wonderful. On that note and on that tone, I am going to ask our mayor, Philip Brown, if he would bring thanks, and then I will close with a few comments. Philip, do you want to unmute and put on your video? Okay, it seems to be quiet. I'm not exactly, oh. Okay, I'm not exactly sure what happened there, but given the time of the evening, and I know the intention that as sponsor of the keynote, I'm sure that he would be pleased, especially, there he is, okay. Hi, Philip, I'm wondering, I just started to speak for you, so I'm glad to see you back online again.
Well, that's a great thing about Zoom. You can zoom in anytime or zoom out.
Yeah, so no, I was just asking if you would bring thanks for our keynote, and then I'll have a few closing comments. So,
well, Trish, as I said in my opening, it's been a great pleasure to be a sponsor of the Atlantic Summer Institute. It's very satisfying to know that it's based here in Charlottetown, the Atlantic Summer Institute, and that we have the opportunity to sponsor such a great event. And I know that I'll be watching over the next couple of days, just zooming in, zooming out when I can. So thank you very much. Merci beaucoup on behalf of the city of Charlottetown and all the citizens of this great city, birthplace of Confederation.
Thank you. And I'm so sorry I couldn't be in your beautiful city right now.
You'll make it one of these days.
I will.
and as a bit of a teaser, I don't know if you can see it or not, but as a bit of a teaser for Prince Edward Island, this is our signature gift for keynote speakers, and we will be sending it to you. So I hope you have your correct postal address on your registration. Otherwise, it could be floating anywhere, right?
That's beautiful. Thank you.
Well, this was actually created by a local artist, especially for the Summer Institute, and it's from our children's program. So we think it's pretty special and like to share it once a year with our keynote speaker. So it will be coming to you.
I will hang it with pride. Thanks very much.
You're welcome.